Well, look, good afternoon, everybody, and thanks for the invitation to come and speak to you about medical marketing. What we wanted to do this morning, I guess, was just really briefly introduce who we are. We have been specialising in medical marketing for over 10 years. I guess that's probably the main thing that you will want to know about in terms of taking any advice from us. And it is an area that we got into strategically. My background, but most of my family are medical professionals of one type or another. And so I really wanted to start an agency that would help medical practices and doctors and medical businesses across the board. We're a full service agency, which means that we offer a broad range of services depending on what practices need. So enough about us. Let's spend the majority of our time actually on medical marketing. And what we're doing, as Karen has said, is a bit of an introduction, I guess, into medical marketing. And so what better place to start than actually asking the question, what is medical marketing? And I find that new doctors that I speak to or new clients that I speak to often have varying, I guess, expectations or understanding about marketing. I think back to when my father was a practicing medical specialist. It was virtually illegal in Australia for him to do any kind of advertising or promotion or communications of any type. And things have obviously changed quite a bit, both in New Zealand and Australia and around the world, to be honest, in the last 10 to 20 years or so. But when we think about medical marketing, there's one thing that I definitely want you to understand, and that is that marketing and sales are two very different things. They come at the whole question from two very different perspectives. Where sales is all about taking what I have and trying to convince someone to buy, marketing actually looks at things from the other perspective and starts with the question, well, what are my end users? What are my customers' needs and wants? And how can we best deliver that service? And here's a definition that I love. It's from the Australian Marketing Association. And it actually says that marketing is the activity and processes for creating, communicating, and delivering value, and managing relationships in ways that benefit customers, patients, partners, hospitals, imaging centres, perhaps specialists and GP relationships, and society at large. And I guess I just wanted to take a moment to set the context when we talk about medical marketing. Obviously, it needs to be ethical. Obviously, it needs to have the end user, the patient in mind, and delivering the best health outcomes and best value, lifestyle value to them that we can. But it also needs to be within all the guidelines around medical marketing for each country, for each college as well. So when it comes to medical marketing, from our experience, and we've obviously worked with a lot of businesses and done a lot of research around what works and what doesn't work, and we've found four key pillars that we've found make a really big difference to medical practices, to how effectively they can operate, how well they can do as a business, but also how well they can service their patients and their referral base if they're a specialist practice. And a lot of it really comes down to three key things. One is awareness, making sure that you're known, getting your name out there. And the second one is a really big one, and that's education, making sure that you give information freely to share and to leverage your expertise. And the third one is just aligning customer expectations with the experience that you can provide and making sure that every customer, every patient, every referral source gets the type of experience from your practice that you would want them to get. And with many medical practices, there are many moving parts. So that can sometimes take intentional effort to A, make sure that everyone knows what they're doing and how they should be doing it, but then also B, looking at making sure you have measurements and feedback loops so that you can maintain user experience moving forward. So what I thought we'd do this afternoon, is just have a look at these four areas briefly to give you an overview of some of the key areas that you should be within each of these that you should be, I guess, thinking about and focusing on. So let's start with strategy. Strategy for a medical practice is actually really important. There was a Harvard business study not too long ago that found that generally speaking in business, people with goals are about 2 times more successful than people without them. And those with written goals are at least 10 times more successful than those who only had them in their heads. So developing a marketing plan both forces you to make goals and also to document them. And that's an instant step in the right direction, because it means that you actually have something to measure against and hold yourself and your team accountable towards. Now, if you're anything like me, if you go to the grocery store, you're doing some shopping for the weekly shop, you've probably found that if you don't make a list of what you want, you'll probably walk out of the store buying a whole lot of things you didn't really need, and possibly even forgetting some of the things that you did go there for or that you need most. And that's another area where making sure that you have a clear marketing plan and strategy is a little bit like that shopping list. It tells you what you need so that you don't waste your money on the wrong things. And that's obviously a very important part of making sure you get the highest return on investment from your marketing investment as well. So what are some of the reasons to develop a marketing plan? Well, you maximize your return on investment. It forces you to set your goals and your key performance indicators. And it can really increase the value that you get out of your practice. It also means that your customer service becomes intentional, that you understand exactly who your customer base, your patient base, perhaps other types of customers you might have as well, like your referrers and so on, are receiving the sort of service that that they should be getting from your practice. Your processes and systems, the software that you use, and how that can help to impact, I guess, the customer journey and experience is really important too. So there's a lot of value add from that perspective as well. And finally, in the context of positioning your practice in the marketplace, who you are, what makes you different, why people should come to you, how you communicate to people, what you communicate to people, and any of the opportunities around it as well, is something that should always be set within your marketing plan for the next 12 months in the context of your longer term goals. So there are a number of reasons why marketing plans are really valuable. So what makes a great plan? Well, I've tried to break this down for you in three areas and kind of relate it back to the clinical process, I guess. First of all, you've got your testing phase or your research phase. And there are a number of different areas that it's important to keep measurement and tabs on within a medical practice. So you need to go through those and do a bit of an audit to see exactly where you're at and how things are going. Once you've done your testing, then you can go to the diagnosis stage, which is where you develop your strategy, set your goals, your positioning, make sure you know your niche targets and your strengths, weaknesses, opportunities, threats. Make sure you've got your key performance indicators all in place. And once you have that, that's when you can go to the third step, which I find a lot of practice managers or a lot of practices actually like to sort of speed over these two steps to really jump to the treatment phase. But you think clinically that wouldn't be the right approach, to just give someone a treatment plan before you've done relevant testing and diagnosis. Same thing with your business as well. And when you get to that activity or treatment phase, that's really when you then start to set the actual tactics and activities that you're going to be running through. That's when you start looking at your budgets and how you're going to measure things sort of at regular intervals. So that's just a little bit for you around marketing strategy and how it can be important and what makes a great plan for a medical practice. So let's have a look at the second pillar. And actually, just before we do, I'd like to challenge you. This time of year is always a really good time for practice managers, for any owners of practices to really take some time out and think about their planning for the new calendar year. So I'd certainly challenge you to do that. So let's have a look at the second pillar and let's consider branding for just a moment. And I guess a lot of people don't really understand what branding is all about. First of all, I can tell you that a brand is not a logo. A brand is no longer what we tell consumers it is. It's actually what consumers tell each other a brand is. And that's a really important point for people to understand and internalize. And simply put, brands are perceptions. and they're perceptions that create reality around your practice. So it's actually quite important to think about all the different touch points that your practice has with its customers, with its patients, with its referrers, with other partners, imaging centers, hospitals, etc., to really think about what perceptions you're creating, what realities you're creating about your brand. I love this quote from Jeff Bezos, CEO of Amazon. He says, "Your brand is what other people say about you when you're not in the room." A brand is actually the sum total of every touch point that results in how referrers and patients and the industry and even the local community around you perceive your particular practice. And branding is, I guess, the act of shaping how your practice is perceived. Although it's really your customers who might decide what your brand is, there are certain actions that you can take to put yourself in the driver's seat. And all the steps that you take to build awareness and reputation around your practice and its products, its services, that's really, I guess, what we're talking about when we talk about branding. So why should a medical practice develop a brand? Well, there's a whole bunch of reasons. Let me just quickly brush over a few of them for you, just to make sure you understand some of the key points. First of all, we know that creating a brand builds value and loyalty over time. We see that in all sorts of consumer brands. We've seen that in medical brands over time, in corporate medical brands and other situations there as well. So it absolutely builds value and loyalty. Another thing that it does, it actually better positions you to expand your practice. You know, gone are the days when medical practices were just the name of, the key specialist that was there. I remember back to my father, Dr. Ian Borody, obstetrician gynecologist, that's who he was. Whereas these days, if you have other specialists, if you have other GPs joining a group practice, if you have allied health being built in, and if you're really starting to expand your practice, it's actually better to do that under a brand that you can build where the customer loyalty, the patient loyalty is actually with the brand. It also makes your practice more clonable. If you want to set up in new areas, if you want to go into new geographic areas or anything like that, it makes it a lot easier to manage and implement that process. And also it makes the practice more saleable by adding that value to the practice. By keeping the equity within the brand rather than individual doctors, it actually means that when you start thinking about an exit strategy, if you're an owner of a medical practice, it's going to benefit you as well. So the question is, what does your brand say about you? I love this photo that I found of a front entrance to a medical practice where you can see the glass door on the left-hand side at the front of the screen there. And someone's obviously felt that it's more convenient for them to leave that gate open so that they can take the rubbish out. But obviously that creates quite a negative first impression of this particular medical practice. And what is your brand? What does your practice say about you? There's a few key things to think about in terms of what makes a successful brand. And we don't have time to go into detail to each of these points, but we're more than happy to help people if you're interested in developing your brand further. But you need to make sure that you know who you are. You need to make sure that you have clear vision and purpose for your practice. And it's important because your whole team needs to be aligned on that as well. They need to be aligned on, what your values are so that they can know how to treat people, how to deal with making decisions around particular instances that might come up in the day-to-day business of your practice. You need to make sure that you have a compelling and memorable brand story, that there's a reason for people to share the story about your practice, and the messaging that you create about your practice is something that actually resonates with your target audience. And even though we like to think of ourselves as being quite logical in how we make our decisions, we know from consumer research and psychology that we make decisions based on emotion a lot of the time. And that's where having strong visuals and having stories and illustrations that can actually engage with people on an emotive and deeper level can be an effective part of your branding and communication strategy. So I just thought I'd show you a quick example of a practice, a small to medium-sized specialist practice that we've been working with for a little while. We've got tons of these sorts of examples. But I just wanted to show you that there's a lot more to how you communicate your brand or your practice than you may have originally thought. It all comes back to thinking about what your patients need, what their pain points are, what they're looking for, what sort of education and information are they looking for, and how can you help to fulfill those gaps. So for these guys, there's a number of different things that they've been developing over time, from practice brochures to different infographics and online resources, also including questionnaires and surveys with different information that can become available for patients depending on their health needs. Obviously, a website's important, and we'll talk about that under digital, as well as your social presence, and even ebooks and resources that various people can take away with them depending on what they're looking for. There's a lot that you can do in that space. So that's the branding side of things, and that is quite important. But when it comes to how you communicate your practice, how people find your practice and interact with your practice, there's really probably nothing more influential these days than your website and your digital marketing. So that was the third pillar. Let's just take a quick moment to have a look at this as well. So when we think about websites for medical practices, and it's interesting, I was having recently doing a bit of an audit of a number of New Zealand GP and specialist websites for some research that we were doing. You may not be aware of this, but recent stats show us that 8 out of 10 new patients will actually visit your website before they visit you. So that means for new patients, a lot of the time, depending on whether you're a GP or a specialist practice, I guess this is a little bit different, but generally speaking, the first impressions are often formed to some degree by your website. And that's where this becomes quite important for you. And there are a few key website considerations that you need to keep in mind when you think about your website. The first one, the content management system, is something that can actually make a really big difference to how effective your website can be for you. And I'll show you a couple of examples of that just in the next couple of slides. But making sure that you have a responsive design, that the actual design changes for different types of screens and for mobile devices, is something that Google now basically demands. But also from a user experience point of view, it's something that you want to make sure you're doing quite well also. And that's related to point 3, which is the user experience. Making sure that people can find the information that they're after, that they can find the online bookings portal, that they can find the forms and information that they need, that they can make payments online. All those sorts of things just make such a difference to the user experience. And I'll give you some stats around that in a moment as well. The content, the images, video that you have on the site, that's all obviously important. And it's actually, we've found, especially with video, patients are looking for education. If they have health concerns or health needs, this is one of the areas that is searched more online than almost anything else. So it's actually, it creates an opportunity for medical practices to differentiate themselves by actually fulfilling that information need and becoming an information portal for patients who are searching. And then the functionality of the site is obviously important as well. It needs to load quickly, it needs to be easy to use, it needs to have all those different functions that patients and referrers are looking for on their website. So let me just show you just a couple of these, and again, fairly top line, but let's just have a look at the content management system, or CMS. And there are a number of different, we're talking about the software that your website is built on, and each one's a little bit different, but probably the biggest thing I want to draw to your attention is that your website needs to be, the content on your website in particular, needs to be easily managed by your team, by your admin team, by your staff. It's not something, it shouldn't be expensive. It shouldn't be something you have to keep going back to someone else to do for you. And here are a couple of screenshots. This is from the Drupal content management system. And there are plenty of others like it out there, where what you can edit and what you can change and how that works can be a little bit limiting, and it can be not so user-friendly, I guess, is the point here. We build all of our websites on the WordPress content management system, and we actually do it a little bit differently as well. With WordPress, there are a number of different modules. It's one of the largest open source CMSs available. And by choosing the right combination of options for when we're building a website, we can actually make it really easy for people to use. So you can see here in the example that, if you want to edit the content that's on a page here, everything's drag and drop. So if I want to move the content over to the right-hand side and the image over to the left-hand side, all I have to do is just click it and drag it and things will move around. If I want to edit text, I can edit anything on the page and simply just click the spanner button and then that'll go in there and I can edit all the content and settings and so on. So it's really important to make sure that your practice is, your website is easy to manage. Just another thing to be considerate of with your website, and I have talked about this already, so I won't go on, but making sure that you have the information that patients are looking for, that you have those smart forms that help to increase efficiencies within the practice and make things more convenient for clients as well, for customers. That you have the resources, that you have the information downloads and FAQs, that you're interacting with your patients and giving them information around seasonal health concerns and other things is actually really, really valuable to patients and something that your website should do well. Now, earlier, Chrissy spoke about with MedTech the functionality there around booking, online bookings. And that's something that we've done a bit of research into as well. We've actually found that 42% of patients, so that's quite a significant number, would like to be able to schedule their own appointments. This is from general research, and 34% want to book outside of business hours. It's not convenient for them to do it during business hours because they're busy, so they want to do it. About a third of patients. But only about 17% of patients find that it's actually easy to book medical appointments online. Now, we did some of our own research in this space as well not too long ago, and it was around medical websites, including specialists, GPs, dental websites, allied health websites, and we were looking at the online booking functionalities. So we basically categorized all the websites into two groups, and one had a book online button, which took people through to a form, like a contact us form, where people could fill in their details and the practice would contact them back to actually book the booking. And the other group were people who had a true online booking system built into their website. So the first group that had the form essentially only averaged a negligible 6% conversion rate of people actually completing that contact us form in order to try to make a booking. In contrast, the websites that had the online booking system experienced 76% patient engagement in booking appointments through the website. And what we found was that a lot of those sites, the bookings were happening outside of regular hours. In fact, one larger practice had 40% of their online bookings occurring outside of regular hours. So, this is certainly significant, and it's something that you really need to be considering. So when we think about your digital presence, your website's important, but your actual digital marketing is just as important, really. And here, what we've found is, and Google has seen this as well, that 85% of people contact businesses found in local searches. And from what I've seen, that number can even be higher for example, for GP practices, where people are really, you know what it's like these days. If you want to book travel, or if you're even looking to buy a house or anything else, we do it all online now. We do it all through search engines. And this is where, for your digital marketing, there's a lot that you can be doing in that space, which is all within medical marketing guidelines, all ethical as well, but can actually increase the convenience for people who are looking for the sorts of solutions and services and treatments that you're providing. So let's just have a quick look at a few of these different areas. First of all, just so that we're all on the same page, when we're looking at a general search engine response. We've typed something in here, in this case obstetrician Sydney. Generally what you'll find is there's 3 different types of results that you're going to get. First of all, up the top here you can see we've got the green ads. So these are the paid ads or the Google ads, which we're seeing at the top of the page here. Then we get the Maps block, which is driven by Google My Business, which is essentially Google's business directory, I guess. And this is something that is quite important as well, because Google places a lot of emphasis on making sure that your practice is listed properly and that you have good information there. The other thing that you'll notice with the Google My Business directory listings is that you also get these reviews in here as well. Now, obviously testimonials are something that medical practices can't do, shouldn't do, and there's a few reasons around that. But generally speaking, sites like Google My Business form a bit of a gray area. And that can be a double-edged sword as well. One of the big questions that we get is, how do I deal with negative Google reviews? What can I do about that? And I'll show you something specifically on that in just a moment. But then under these listings here, the GMB listings, then you have your organic listings. And these are the websites that Google is putting at the top of page 1 based on the content and the structure of the actual website. Google's constantly scanning every website that's out there. And when they do, they're looking at the information that you have, and then they're matching that up with what people are searching for. And depending on the quality of your content, the extent of your content, and a few other factors as well, like backlinks and some of your SEO that you're doing in that space, that will determine where you sit in terms of a Google search. And I don't think I need to tell you, if you're not as high up on page 1 as possible, chances are you won't be found. And that's where these Google ads become quite important, especially on mobile devices. You think about on your mobile phone, when someone does a search on a mobile phone, they're going to see all these paid ads first, and they actually have to scroll down on that small screen quite a way before they start to see the organic listings. So just, I guess, to quickly summarize some of the different areas you should be thinking about here. First of all, you've got your search digital marketing, and that's really in relation to exactly what we were just looking at. When someone puts in a search term in their Google or their search engine, what's going to come up, and how are you going to come up compared to other people? And there are so many little things that many medical practices miss. It's not just about people searching for doctor in your area or suburb. It's people are searching for symptoms, for conditions, for treatments, treatment options, for all sorts of different things. And it's a matter of ranking well for a number of different search queries. You've also got display ads, and these are the types of ads that you see on social media platforms as well as on websites, and they're the graphical ads that you see. And there's actually quite a bit that you can do with those depending on the field of medicine in particular, where you can really interact with patients. And we find that educative or education-related ads can actually work really well in that display space. You've also got a thing called retargeting. And if you have ever perhaps gone to an online store to look at a particular type of product, you may have found that for the next week or two, all the ads that you see tend to be around that type of product that you were shopping for or researching or looking for. And that's a form of retargeting. Now, in medicine, we don't want to annoy patients by by following them around or stalking them online too much or that sort of thing. But there are certain instances where that can actually be a really effective way of just reinforcing messaging for your practice. And the last one I just wanted to mention was also your social presence. There is a lot that you can do in that space as well that can be really effective for your medical practice. Now, we were looking at Google My Business just a moment ago, and I told you that the whole negative review issue is one that we see a lot of. So we've actually got an online resource that's free. If anyone does want to download that, feel free to just write down that URL at the top of the screen, vividus.com.au/resource/neg review. and you're certainly able just to access that. It's quite an in-depth resource that we put together because we've just been getting so many questions on this topic. So look, we're almost at the end here. Just a couple of things, I guess, to raise with you as well. That final pillar was really all about reputation, which is closely linked to referral, whether that be word of mouth referral, for example, with GPs and allied health. Often, you know, what one patient says to their friends, family, neighbours, etc., about a particular doctor or practice, but it's also referral from the perspective of GP referrals to specialists as well. So that's what we're talking about with reputation. And the biggest part to reputation marketing is really all around the experience that you provide. You know, it used to be that you could differentiate yourself years ago based on product and then service. But what we've found is that because of the, I guess, the shrinking of the world through social media and through the internet, you know, one person might start to provide a service that's unique in one way, and all of a sudden, everyone else is doing it as well because of that shrinking world effect through social media and the internet. And what we're finding now is that really the best way to differentiate your service and your practice is around how you make people feel. You know, how are they really doing when they leave your practice? Where are they at? And depending on, you know, the health challenges that individual patients may be facing, obviously that can be difficult, but there's certainly ways of differentiating your practice on how you make people feel. And there's a few key things that you need to be doing in order to intentionally and consistently provide a high level experience for your patients and for your referral base. So things like making sure that you have feedback loops in place, that you have the opportunity for people to provide feedback on their experience. Things like blind shopper is something that we do quite a bit with practices, where we will have someone actually go through the process of making a booking and visiting the practice, so that we can report back to the leadership or the ownership of the practice to let them know how they're doing in terms of patient experience. Making sure that anyone who's answering phones is really well trained in how to deal with specific questions, issues, and making sure that everyone feels welcomed as well. The waiting environment is something that Chrissy spoke about in terms of kiosks. And another thing to keep in mind here as well is what we call proxy perceptions. And I don't have a lot of time to go into exactly how they work, but it's basically perceptions or realities that are built on a proxy. So what I'm talking about are things like, if, for example, all the reading material in your waiting room is outdated, then patients are going to start asking themselves questions like, well, if this is outdated, what else is outdated in the practice? If they go to your bathrooms and they're not clean and tidy, that's another proxy perception where they'll start asking themselves questions like, if the bathroom's not tidy, are they sterilizing properly? Are they cleaning everything else properly? So it's really important. And you know, there's a number of other points there that I've listed under experience in terms of pre to post consult experience, callbacks, team evaluation and PD. There's certainly a whole program that needs to be developed around your practice to make sure that you're doing this well. And there are a number of things that you can do to actually build loyalty and trust for GPs and specialists and allied health. You know, with your patient, there are things that you can be doing in regards to electronic direct mail or email marketing, social platforms, webinars, resources, different things like calculators and so on, which can actually provide reliable healthcare information to your patients. And for specialists, building loyalty and trust with GPs, you know, there are a lot of things that you can be doing in that space as well, just to provide valuable information and also just to make sure that you're managing relationships effectively. We're pretty much out of time, but just very quickly, I thought I'd just give you a couple of examples. Here's an example of some educational emails that have been sent out to patients and to GPs. And what we find, if these are done well, you can actually get really high open and click-through rates, which just goes again to prove how interested people are in high-value health-related material. Webinars, just like the one you're on here, is something that we actually host a lot of webinars for specialists who are building closer relationships with their GP base, and that's something that can actually work really well also, both in fostering relationships as well as in getting new referrers for the practice, for the doctor. So there are a few common mistakes, specialists. This is really for you, I guess. Just one slide at the end. We have a whole session that we do on referral marketing for specialists. But look, there's just a few things to be keeping in mind. You need to make sure that you are differentiating. You need to be answering that question, why should a GP refer to you as opposed to any of the other options in your field? You need to make sure that people feel valued, and there's a whole bunch of things that specialists really need to be looking at from that perspective, especially for the GP practices that are referring to them. It's important that you know your prioritized referrer list, and some software is really good at exporting this sort of data and running these reports, and others can be really clunky. So it's something that should be done regularly, and if it's not easy for your practice manager to do this, then it's probably worthwhile just dropping us a quick line, and we can give you some tips on how to do that better. There's a bunch of other points there as well, not being proactive in terms of building loyalty, not asking for referrals, and that obviously needs to be done appropriately. And that's a whole hour session in itself. Using appropriate incentives for referrals, and for example, just saying thank you can be an incentive. And inconsistent experiences and interactions is obviously something that hurts in that space if you're not doing it well. So look, everyone, I hope that you have received some really good value out of that, and hope that that's got you thinking about a few different areas of your marketing that you can improve for the next calendar year, and perhaps be intentional and work on as well.